Do you think that you might be pregnant? For some, this could be a blessing or a disaster. In this video, we will discuss the early symptoms women experience in pregnancy, when you should perform a pregnancy test, and what to do next. Am I at risk of being pregnant? Having unprotected sexual intercourse at any point in your cycle can, in theory, put you at risk of pregnancy. Unprotected intercourse within the first 3 days of a natural menstrual cycle is unlikely to result in pregnancy. However, predicting the first 3 days of your cycle can be difficult, and every lady's cycle is different. Therefore, if you have read this fact online, don't dismiss the possibility of pregnancy. Are there any symptoms of pregnancy to look out for? Pregnancy symptoms can vary for every lady, and it's very much an individual experience. But here are some of the signs and symptoms you need to look out for. Light or missed period. For many ladies, the first sign of pregnancy is a missed period. This sign is more accurate amongst those ladies with a very regular cycle. Light or missed period occur due to the hormonal changes at the start of pregnancy. Be aware some ladies still experience a bleed in the early stages of pregnancy. This is typically lighter than their regular periods and is likely related to implantation bleeding. This is where the embryo starts to make its attachment with the lining of your womb. Nausea. Many report an experience of nausea and vomiting in the early stages of pregnancy, known as morning sickness. In contrast to its name, morning sickness happens at any time of the day. The nausea usually starts to develop after the 4th week of pregnancy. But as always, some ladies do not experience any sickness and others are severely affected. In its most severe form, some ladies cannot keep down fluids and can become very dehydrated. This condition is called hyperemesis gravidarum. If you are experiencing nausea and vomiting and cannot keep fluid down, you must consult a doctor urgently. Tenderness to the breast. During the early stages of pregnancy, hormonal changes can result in fuller, swollen and tender breast. This sensation may resemble the changes you typically experience before your period. As the pregnancy progresses, the skin around the nipple can darken and the veins in the breast may become more noticeable. Fatigue. In early pregnancy, some ladies experience increased tiredness or even the sensation of exhaustion. Some people may become more emotional or upset due to the hormonal changes. Peeing more. In early pregnancy, you will probably notice that you need to pass urine more frequently. This is typically worse during the night. This will continue in later pregnancy as your womb increases in size and exerts pressure on your bladder. Increased sensitivity to smells. You may notice a heightened sense of smell, becoming more sensitive to particular odors such as cooking smells, cigarette smoke, spoiled food, perfume, spices, and coffee. One theory of why this happens is that your body aims to do everything it can to protect the developing embryo. And by increasing your sensitivity to smell, you are less likely to eat or drink anything that may contain toxin or potentially be harmful to your baby. Change in taste and cravings. You may have also noticed a change in the way you taste food. Some ladies also report a metallic taste in the mouth. Foods that you have been partial to before the pregnancy may now appear less appealing. You may notice the development of cravings for food that you have previously rarely eaten. It's also common for ladies who smoke to lose interest in smoking. Testing. Even if symptoms we have discussed don't resonate with you and you have still had unprotected sexual intercourse, there is a chance that you could still be pregnant. At home, you can opt for traditional urine pregnancy tests. These tests are most reliable after the first year of your missed period. However, there are some very sensitive early detection variants available over the counter that can detect pregnancy before you miss your period. Suppose you're unsure when your period should have been. Try to ensure that it has been at least 21 days since you've had intercourse. When performing the pregnancy test, ensure you clearly follow the manufacturer's instructions. Failure to do so can significantly impact the reliability of the test. If a pregnancy test is positive, it is highly accurate and almost certain that you are pregnant. In the past, negative test results were not always reliable, but modern pregnancy tests are very sensitive, and a false negative is unlikely unless it's a very early pregnancy. However, it can happen occasionally with some tests. If unsure, you can take a second test 2 or 3 days later. If your test is positive, what should you do next? This can either be a very happy or distressing time. If you're planning to continue your pregnancy, make sure to book an appointment with your doctor or midwife to organize your antenatal care. If you don't want to continue the pregnancy or want to explore your options further, make an appointment with a doctor or the National Unplanned Pregnancy Service in the UK. Remember, healthcare professionals are committed to keeping your information confidential and shouldn't judge your decision. We hope this video has been helpful. If you have any questions, discuss this with your registered doctor.